Good morning, everyone. I'm Barb Short, Senior Director of Corporate Social Responsibility at Sanofi. We're thrilled to be a part of this year's summit as a capstone to a years-long series of conversations co-sponsored with the Globe team focused on the advancement of health equity. At Sanofi, we chase the miracles of science to help address unmet healthcare needs around the globe, and we're deeply committed to doing our part to help eliminate health disparities and access gaps. Today's conversation, focused on the LGBTQIA+ community, puts a much-needed spotlight on the health disparities experienced by members of the community and families. It's our belief that by working together, we can help advance better health outcomes in the LGBTQ+ community, communities of color, the disability community, and among women. Again, at Sanofi, we are honored to join you today, and we look forward to learning with you what we can all do to advance health equity. So now I'm delighted to introduce Dr. Alex Keuroghlian, who is the Director of National LGBTQIA+ Health Education Center at the Fenway Institute, and we found some synergies already in our conversation. And Theresa Gaffney, who is Morning Rounds writer and podcast producer for STAT. Theresa, I'll pass it over to you.
Thank you so much to everyone for joining us, and thank you for the introduction. Before we get going, I'll just say, please send in any questions you have. Dr. Keuroghlian is very busy, so it's very nice that we have them here for our questions today. And so thank you again also for joining me. Maybe just to start, before we get into what might be a little, less fun, the inequalities that persist, let's talk about the advancements in care. What innovations or developments have happened in queer healthcare in the past, many years?
Yeah, first of all, thank you for having me here, and always great to speak with you, Theresa. It's, I would say, the best of times and the worst of times in a number of ways. We've had incredible advances in care for sexually and gender diverse people in recent years. For a variety of reasons, there's more and more funding, for example, through the NIH, which has an Office of Sexual and Gender Minority Research that continues to ramp up funding in areas of LGBTQI+ health that haven't historically been funded in the same way. In the past, much of the funding has been focused on HIV and sexually transmitted infections, which are certainly important areas for us to continue to innovate in and make progress on. There is a lot more to queer and trans health than that. And we've seen investments, for example, in refining gender-affirming medical and surgical care. We've seen investments in mental health care for LGBTQI+ people. We're seeing a very exciting increase in investments in care for intersex communities and people with variations in physical sex development, for example. And all of this happening in a way that's community-led and community-informed, based on the centuries-old political adage of nothing about us without us, this idea that we no longer do research on marginalized communities, we do research with communities that ideally is led by the voiced priorities and needs of those communities. And that, for LGBTQI+ people, means that we're involved in funding decisions, in planning of research, of designing studies, implementation of interventions, evaluation, dissemination of those findings as well. And that way we can make sure that the work is relevant to and responsive to the needs and hopes of the communities we seek to serve.
Yeah, and I want to ask about specifically maybe advancements in surgery. This is a huge, point in political discussions right now. Well, can you talk a little bit more about the advancements in surgery that have happened for specifically trans folks, gender-affirming surgeries in the past decade or so?
Yeah, well, the advancements from a technical standpoint have really been occurring over a number of years, over a number of decades even, and I'm sure there will continue to be innovation in that regard moving forward to make these surgeries less invasive and to improve the overall experience that people have. But I would say the most important advances in my mind are policy advances. For example, a decade ago in Massachusetts, Deval Patrick, who was governor at the time, signed into law a prohibition of exclusion from insurance coverage for gender-affirming hormone therapy and surgery, which meant that insurers in Massachusetts could no longer exclude trans and gender diverse people from receiving insurance reimbursement for gender-affirming surgery. And we saw an exponential increase when that happened in trans and gender diverse people seeking gender-affirming surgery in Massachusetts. It also made gender-affirming surgery a viable business model for hospitals and academic medical centers. So soon after that happened, we saw one by one every major academic medical center in Boston ramp up and open up a world-class gender-affirming surgery center. We now have these at Mass General Hospital, where I'm based, at Brigham and Women's, at Beth Israel Deaconess, at Boston Medical Center, Boston Children's Hospital, and excitingly now we have gender-affirming surgeries being performed in other areas of Massachusetts, at UMass Worcester, at Cooley Dickinson in Western Massachusetts as well. And that was really the result of a policy that ensured that these procedures were covered and that was financially possible both for the patient and for the health system to deliver these. And that's really where we see progress being more precarious in other parts of the country, where there are policy-related restrictions on access to gender-affirming medical and surgical care.
Yeah, and you and I talk so much about the kind of national state of queer health, but I'm excited to talk kind of locally today. You just mentioned all these major centers in Boston in particular. How do queer people maybe benefit from, in Massachusetts, from living so close to these, major medical institutions? How is care advancing, here specifically, maybe because of that?
Yeah, definitely. Well, there's a deep, rich history of care for sexually and gender diverse patients here in Boston. I have to name Fenway Health, where I spent a lot of my time, that was founded over 50 years ago and from the beginning has been focused on providing the highest quality care for sexually and gender diverse people. Certainly once the HIV epidemic hit in the early 80s, that became a primary focus. And Fenway's now remains the largest provider of transgender health services in New England, sees over 5,000 trans and gender diverse people in primary medical care each year, largest provider of HIV services in New England, seeing over 2,300 people living with HIV. And that community health center in Boston became a model not just for the city, but for health care organizations around the world. When I travel in Eastern Europe, Africa, the Caribbean, East Asia to advance this care, people know about this community health center in Boston, and it's still the model that people look to. What's happened, interestingly, is that this care in Boston that used to not be provided in a culturally responsive, safe, welcoming, inclusive, affirming way through our academic medical centers has in recent years made its way into those academic medical centers. So we really benefit as a community here in the Boston area and certainly in Massachusetts from having robust services of different kinds for various LGBTQI plus populations in town. I direct an advanced course at Harvard Medical School called Caring for Patients with Diverse Sexual Orientations, Gender Identities, and Sex Development. And we've been doing this for over 7 years. We've had dozens of medical students devote a month of their education to spending all their time at various practices in the Boston area that serve LGBTQI plus people. And it's amazing what breadth we can put together for these students to learn from. They're at Boston Children's Hospital in the Gender Multi-Specialty Service, in Being You, which serves intersex kids. They're at Cambridge Health Alliance in the HIV practice there. They're in child psychiatry in our gender identity program at MGH. They're in gender-affirming surgeries at Brigham and Women's Hospital. They're in the transgender support group at Boston Healthcare for the Homeless. And it's really, I think, unique in the country and around the world that we would have this depth and breadth of health services for LGBTQI plus communities. That being said, we still have wait lists that are months long. So while we're doing a lot and leading the country and the world, there's so much more to do in terms of access to services and the degree to which those services are culturally responsive for our communities.
Yeah, and that brings me to my next question, which is, there's this idea of Massachusetts and Boston as a kind of progressive haven, for many communities, but especially for LGBTQ folks. And, when it comes to healthcare, I wonder, is that true? And, what are the nuances there? What are some of the barriers that queer people still face trying to access care here?
Yeah, I would say I can't think of anywhere I'd rather be a patient as an LGBTQI plus person, or where I could do more for my LGBTQI plus patients, given the resources that we have here, including mass health and essentially universal coverage for these services for a population that's also been economically disadvantaged and continues to be. So I think we're doing better than anywhere else I could point to. That being said, there are certain challenges in terms of access and this being a safe haven that we haven't totally overcome. And there are major inequities still, if we think intersectionally about LGBTQI plus communities, in terms of communities of color. I am acutely aware of the fact that our hospitals and health systems here in Boston have not always been welcoming and viewed as safe places for our Black and African American LGBTQI plus community here in the Boston area, for Indigenous LGBTQI plus folks, for immigrant communities who have linguistic needs that may not be met. So I think this next important frontier for us is to think intersectionally, that LGBTQI plus people will have a range of additional oppressed minoritized identities with regard to race, language, culture, religion, ability, citizenship status, and we haven't really built the system that we need to and achieved our goals if our systems aren't equally open to, accessible for, and responsive to all of these communities with a range of unique needs.
Yeah. And we talk a lot about Boston in Massachusetts as a kind of epicenter of healthcare, but what about the folks, way out west? Like, what is the kind of, how is their care maybe, or access to care different than ours here in town?
Yeah. We've done studies showing that people travel from far and wide to come into Boston for gender-affirming care, for example. And people shouldn't have to leave their local community to access medically necessary evidence-based care. We did a study in 2019 called Plan and Act for Transgender Health, the PATH Project, which was a transgender health services planning study based in Western Mass that also included community members from Vermont, New Hampshire, Connecticut, and upstate New York. And we found that people were traveling several hours routinely into Boston, to Fenway, for example, to access gender-affirming care. And based on that transgender health services planning study, where we engaged transgender and gender diverse adults, parents and guardians of transgender and gender diverse youth, and healthcare professionals in those same non-urban and rural counties, we produced a report that was on the basis of establishing Trans Health in Northampton, which is a health center by and for transgender and gender diverse people that's continued to grow since then. So that's made a big difference in Western Mass specifically. I mentioned earlier that UMass offering now vaginoplasty, including a very state-of-the-art procedure, is wonderful because it means that this type of service is not just available in Boston at the usual suspect academic medical centers here, and UMass obviously is a fantastic medical center, is not within Boston per se, so that's progress. And a lot of this is something that we've tried to address with telehealth. During the COVID-19 pandemic, there was a relaxation of restrictions on telehealth care across state lines, and in 2020, from March to September, Fenway Health, for example, and we published a paper about this, served trans and gender diverse people from 25 US states who were via telehealth accessing care here. When those telehealth permissions were then tightened up again, we were no longer able to serve people across state lines. And this has been a challenge in terms of these restrictions on gender-affirming care in other states as well, where we would love to be able to help them through our amazing resources here in Boston, Fenway, the various academic medical centers, but a lot of those state-level restrictions on provision of gender-affirming care include restrictions on telehealth as a way to deliver that care. So we're trying to work around that, but certainly telehealth has become a major part of how we deliver care to queer and trans communities here in the state.
Yeah, and in thinking about that, the kind of national atmosphere around it, specifically gender-affirming care, it was in 2022, right, Boston's Children's Hospital was getting bomb threats, kind of specifically spurred by or related to, the gender-affirming care that they provide there. And I'm wondering how, as the conversation has continued over the last few years and the atmosphere has gotten more and more hostile to gender-affirming care, how has that affected the care that can be given, even at, institutions like Boston Children's and, all around the state.
Yeah. Well, it's true that Boston Children's was receiving a range of threats rooted in disinformation about the care that they were providing. There was a lot of disinformation that gender-affirming surgeries are being performed on young children, for example, which has never happened and is not the case. So it wasn't really grounded in truth and was being stoked for political purposes. We also had threats at the National LGBTQI+ Health Education Center at the Fenway Institute. We had a voicemail in August of 2022, the same year, from somebody saying that people were coming to kill a pediatrician who works with our center. We reported it to the authorities. 3 months later, in December of 2022, the FBI reported that they'd arrested this person who made the threat on charges of transmitting an interstate death threat. This was a 38-year-old gun and ammunition business owner from Comfort, Texas, who had made the threat. FBI had arrested him. It was reported on CNN, the New York Times, Washington Post, Boston Globe, and this person then pled guilty, was convicted, and sentenced. So this is no joke. And what I would say is that, by and large, in Boston, we've seen incredible support from leadership at our academic medical centers, at Fenway Health, at our medical school, for example, and people aren't backing down and, in fact, are being very vocal about the need to continue to deliver this medically necessary evidence-based care. Now, I will say that in some cases, programs have thought twice about the extent to which they want to or are safe to advertise the services that they offer online, for example, and that hinges on faith that the community word of mouth is going to get people in for care, but people who aren't plugged into community in the same way may not, find out about this program being available, for example. So it does create problems. We have a paper coming out in just a couple weeks that I did with 5 of our Harvard medical students on information on US hospital websites about services and policies for sexual and gender minority patients. And there are major sort of shortcomings in terms of the extent to which these services are advertised nationally. We've seen that, and that's part of the point of these threats, I think, is to make these services less visible and to reduce access in that way. So it's incumbent on those of us who provide these services to do a lot of proactive outreach, engage community so that folks know where and how to access the care that they need.
Yeah. And you mentioned so much work that you do with medical students. I'm curious, how is LGBTQ care incorporated in medical schools, and is it enough, and how does that kind of trickle down or affect patient care? Yeah,
great question. This is a huge part of what we do at Harvard Medical School. We have a sexual and gender minority health equity initiative where we've been, since 2018, in a very deliberate way, with support from our dean, George Daly, incorporating LGBTQI+ health into the core 4-year curriculum so that every medical student graduates prepared to provide excellent care for all LGBTQI+ patients, whether they're going to specialize in care for this population or not, no matter what they go into as a surgeon or pediatrician or OBGYN or psychiatrist, for example. And we incorporate it into the preclinical coursework, into the clinical rotations, and some advanced courses, one of which I mentioned earlier. There is so much energy in the student population around this, such a desire and hunger to have this training. Our students are incredibly involved in development of the curriculum. They view this as one of the major human rights issues of their time and of their generation, and they're really the wind in our sails. So there's demand from our students to see this. We also have very robust representation of LGBTQI+ people in our student body, and that is where a lot of this momentum is coming from. And it's important to create a healthcare workforce that represents the full diversity of all the communities that we seek to serve, and that's prepared to provide this care in a culturally responsive way, and also trained to be very creative, thinking about how to innovate in medicine and in healthcare for LGBTQI+ people. We like to think that we're training the leaders of the future in medicine. And I've already seen in recent years some of our students who've graduated continue to do incredible work in terms of publishing high-impact studies that are changing care, going into health policy, and developing programs wherever they land after their education and training to expand access and services for LGBTQI plus people. So that's the thing that gives me hope. That's my therapy, is working with these trainees, because I think we're in good hands with the next generation.
Yeah, and we've just got a couple minutes left, but I have to ask, we have a presidential election coming up. How are the results of that going to affect care for queer people, nationally, but also maybe even here in New England?
Yeah, I think it's going to have a huge impact either way. And so much of what we have been able to do, all of us who are in this field of LGBTQI plus health, has been thanks to federal support, whether it's through the NIH, the CDC, the Health Resources and Services Administration. Who is in office really matters in terms of continuing to support this kind of critical public health effort and to invest in the health of all communities. So we're certainly very invested in a good outcome for the election this November, and are doing everything possible to ensure that that happens. Many of us didn't go into medicine for any kind of political reason. We did it because we're caretakers at heart and want to make sure that we're serving people and healing folks. And we find ourselves often involved in policy or in advocacy in a way that is surprising but necessary. And it's hard to divorce serving LGBTQI plus patients and communities from the societal and political context in which that occurs. So everyone should head out and vote. And if we do that, I think we'll have a good outcome and we'll be well positioned for much more progress in the years ahead.
Well, and maybe my last question in 3 to 5 words, let's say, what are some advancements that you're hoping to see in the future in the next 5-10 years in LGBTQIA plus healthcare?
Yeah. I would say mental health interventions developed by and for LGBTQI plus communities, and community-engaged research in every area of medicine.
Awesome. Well, thank you again so much for joining me. I really appreciate it, and
Thank
it's
you.
always great to talk.
Thank you, Theresa. Always a pleasure.
Thank you.
Well, thank you both so very much. I know we will be looking for the study by yourself and your students. I think a couple of words struck me. Nothing with us, nothing for us without us. Policy, business value, push innovation when there's pushback, research, and the next generation. So I just want to thank you both. I know I will be following your work, and I think we all should be reading your coverage of all of this. And I know all of us at Sanofi are very, very supportive and interested in what's to come. And I also, the last word was the global model, and that there's not necessarily enough for folks to access. So I think moving and expanding and ensuring that all of this works. So thank you very much for your leadership.